back on the Zero Hour. I'm your host, Richard R.J. Eskow. Diane Archer is coming back on the program. Very happy about it. She's the founder and president of Just Care USA, which is a digital hub that covers health and financial issues, especially those facing boomers and their families, and promoting, meaning, let's face it, older people, and promoting policy solutions. She's the past board chair of Consumer Reports. She's got all sorts of qualifications, including founding the Medicare Rights Center, and she's written a recent piece about what's happening to Medicare kind of below the radar, and I really wanted to talk to her about it, so I'm glad she came back on. First of all, Diane, thanks for coming back on the program.
Thanks for having me.
So how did I do in my introduction? Did I mangle anything?
You did a very lovely job. Thank you, Richard.
Okay. Now this piece, which I saw in Common Dreams under the headline, "The Ghost of the Trump Administration is Haunting Medicare," which is, a horror movie I never want to see. Tell us about it.
Okay, so here's what's going on. The Trump administration put in place an experiment that effectively turns the traditional Medicare program into private insurance that works much more like Medicare Advantage. So just to step back, everybody with Medicare has a choice between traditional Medicare, which is public insurance. You go to whatever doctors you want, whatever hospitals you want, and the government pays for the care that you need. And private insurance, where the government actually gives a big fat check to insurance companies to cover your Medicare benefits. And the problem with private insurance for people with Medicare is that those insurance companies have every incentive to pocket the money they get from the government and profit more as a result. So what they do is they set up a structure that makes it hard to get care, costly to get care, and they end up delaying and denying people's care at inappropriate levels, even according to the federal government. So people like Medicare Advantage, we can talk about that, or they say they do, but a lot of people opt for traditional Medicare because what they like there is the freedom to go to whatever doctor or hospital they want and know that their care will be covered.
So let's talk about one of the primary differences, as I understand it, Diane, but correct me if I'm wrong. Right now, the way Medicare works is you have a choice between regular Medicare, where you can pretty much see any doctor, go to any hospital you want. Somebody might not accept Medicare rates or whatever, but it's open, and you don't have to face the level of utilization review, for example, pre-certificate, getting permission to do certain things that your doctor wants to do, you agree to do, and so on. Right now, you have the choice between those two things, and Medicare Advantage offers inducements to try to get people in, but then when they get sick, sometimes they find out it's like an HMO, they can't do the things they wanted to, they don't have as much choice, maybe providers aren't on their panel, whatever. But right now, at least, there's a choice. Maybe people get bad, go into Medicare Advantage and then have bad news if they get sick, but at least there's a choice. What you're talking about now, as I understand it, is privatizing Medicare itself. So in a sense, there is no choice. Is that right? I mean, in areas that do this thing that the Trump administration started, you can't even choose traditional Medicare as we understand it. Is that right? Do I have that right?
You have that exactly right, Richard. You can choose traditional Medicare, but it's not the traditional Medicare that you're choosing that you end up getting. And so it's a false choice, right? They're telling you can choose traditional Medicare, but then all of a sudden they're assigning you to a managed care plan, to an insurance company who is going to decide what care you get and when you get it. So the problem is twofold. They're taking away your choice of traditional Medicare, and they're not even telling you. They're allowing you to believe that you're signing up with traditional Medicare. They're fooling you. And then there you are in this private insurance plan, and you have no idea what's just happened to you. And if you need a lot of care, you are going to have restrictions on the care you can get. And if you want to go directly to the doctor, most likely you won't be able to. You'll have to get approval from the insurer.
So what is going on with this? Exactly is this happening? Obviously, it hasn't happened in the whole country yet. Is it specific areas, specific regions that they're starting to completely privatize it, or what? How's this rolling out?
Okay, really good question. So during the Obama administration, there was an experiment that is continuing in which the Medicare program was giving money to doctors to manage the care of their patients in the traditional Medicare program. And the idea was if doctors were in charge, they could use the money in ways that maybe the traditional Medicare program wouldn't normally allow, for transportation or for other incidentals that could improve people's health. And what the Trump administration did was say, why not just give the money to the insurance companies to manage people's care, or to other for-profit entities to manage people's care? Why should it just be doctors? And so they have begun already assigning people to groups that can be for-profit insurance groups throughout the country that are allegedly managing people's care. What they're actually doing with the money, we don't know. The goal, allegedly, is to save money. But here's something we do know. The government just came out with a statement saying that private insurance in Medicare has never saved money. Never, ever saved money. It has cost us money year in and year out over the last several decades, actually. So if the goal of this is to save money, why would you be experimenting with private insurers which have never been able to save money, which have always cost us more? So that's question number one. The second goal is to improve quality. Well, again, what you learn when you look at the data is that there isn't the data to know what the insurers are doing with the money that they're getting. And there has never been a definitive finding by the government that insurers are doing anywhere near as well in terms of providing quality care as traditional Medicare. So the whole thing just is obscene because we're giving insurers money basically to raid the Medicare program with no reasonable belief or data to suggest that these insurers are going to do anything good with the money. In fact,
and I'm sorry to interrupt, but again, we're talking to Diane Archer, president of Just Care USA. There's also, as you point out, Diane, there's data to the extent that they provide data, and it's sometimes a black box, but the data suggests they don't save money. So why give it to people who have proven they can't get the job done, number one. But number two, even on a philosophical level, it just doesn't make sense to me because why would a public good like Medicare be turned over to private corporations or organizations? It's one thing for a public agency to say it has to meet its, certainly it's trying to control costs and so on, but you're actually giving it to people whose motivation and whose income to a certain extent is based on the denial of care. Not, the government mission with Medicare is to provide the care when it's needed. It seems to me the private sector's goal is to deny the care, and therefore you're turning this program over to people whose fundamental incentive is contrary to the purpose of the program itself. Do you get what I'm trying to say here?
Absolutely. That's exactly right. And what I like to say, to explain this as simply as possible, is that if you and I, Richard, decided we were going to create a private insurance company that did well by people who were sick, that provided the best possible care out there, we would find ourselves in a situation where we couldn't continue as a business because people who were sick would sign up And that would cost us a lot of money. And people who are healthy, we'd have to raise our premiums. So people who are healthy would leave. And we'd end up with a plan that was so expensive that nobody could afford to join.
Right.
And
that's
so
the death spiral.
That's the death spiral.
Right.
Exactly right. And so the problem is that even if you're a good guy insurer, you can't behave like a good guy in this environment. The competition is actually driving people to deliver less good care, less costly care if they want to survive financially as a business. So companies that say, we want you if you have cancer, don't exist in the Medicare private insurance space. And that's what we need with healthcare, right? We want insurance that says, if you have a serious and complex and costly condition, we are going to make sure that you get the best care possible. And that's what the federal government has always done with traditional Medicare. It's been there for you. You can go to, as we've already discussed, almost any doctor or hospital in the country and get whatever care you need. The problem is that what Congress has failed to do is to put an out-of-pocket cap in traditional Medicare.
Exactly.
So it has become
to these other programs because in fairness to them, they may not have the money. So they go to another program that is using taxpayer dollars to induce them to go in, and they don't realize if they need serious care, they may find that the plan they chose is an impediment, right?
That's exactly right. And let me say something else. The whole idea with the private insurance and Medicare is these plans are supposed to be competing. There is no good data that distinguishes them. So again, maybe there are a couple of good guys. There's definitely some bad actors out there. We know from the government that there's widespread and inappropriate delays and denials of care going on in the Medicare Advantage program. So everybody needs to beware when they're making a choice. But nobody knows when they're making a choice if they are making the right choice or the wrong choice. Right. And that is a gamble that no one should have to take, much less people who are older, people with disabilities who could develop, if they don't already have, serious complex conditions for which they need a lot of care.
Right. Absolutely. And so before I let you go, Diane Archer, and I do encourage people to read this article that goes to the Trump administration is haunting Medicare. I guess twofold question. Part of it is there any chance the Biden administration is going to put a stop to this? And what can people do, if anything, to raise their voices against this, because it's disturbing, and perhaps to raise their voice for strengthening Medicare so people aren't drawn into restrictive for-profit systems? Okay,
so let me actually answer those two questions and the third. There is already a pause on a piece of this privatization program, but another piece is going full speed ahead, and that is very worrisome. So it does need to be stopped, and everyone who can should be reaching out to the Biden administration and to their representatives in Congress and asking for a stop to this initiative. That if there's going to be an experiment using private insurers in Medicare, then that experiment should be undertaken on the private insurance side of traditional Medicare. We should not be taking away people's choice of traditional Medicare. It's a usurpation of congressional authority, and it is not what people have been promised from the government in terms of a choice. Public insurance is also much more cost effective, and everybody should be aware that Medicare Advantage is actually eating into the Medicare Trust Fund and really putting it at risk in a major way. But let me say one more thing that everybody should think about, and we can come back and talk about this another time. There's a lot of confusion about private insurance. And the confusion stems from the fact that in Europe and in other wealthy countries with universal coverage, there is private insurance. And that is true. Also, with large employers, there's private insurance, and people tend to like that. But there's a huge difference between private insurance in those other countries, and even in many cases with large employers, and the insurance that people get under Medicare Advantage. And that is that with private insurance in Europe and large employers, the government is paying the claims and is not allowing insurers to profit from denying care.
And let me just interrupt you for a second. It's also setting the rules, which is critically important. And
that's exactly right.
Just to underscore what you're saying, Diane, and then maybe we'll have you come back and talk about this at length. Is, I had a back and forth with Paul Krugman about this once. Is they don't have the history of a predatory culture in private health insurance like we have here. And I know, because I used to work in that business, that so turning it over to a Swiss nonprofit insurance company is not the same as turning it over to United Healthcare or somebody in this country that has a long history of profiting. And I'm not singling them out, the private sector as a whole, long history of making money by denying care. So I guess that would be my agreement with you. So
exactly right.
So I encourage everybody to read your article and find it on Common Dreams. Also encourage them to go to, is it justcareusa.org? Is that the website?
It is, yes.
So see that. So Diane Archer, president of Just Care USA, and one of my gurus on Medicare. As always, thanks for the great work. And as always, thanks for coming on the program.
Thank you, Richard.
And we will be right back after this. I am Richard R.J. Escal, and this is the Zero Hour.